Hey, this is Patrick with Recovery Conversations. Thanks for being here. Before I forget, I'm going to ask if you or anybody you know has gotten well by non-traditional approaches. I want to know your story. Or if you help people get well in non-traditional ways, I want to know your story. So please reach out and let me shoot some video with you. Thank you. So today I'm going back to Dr. Melissa Dittberner, also known as Dr. Mo. The first person I interviewed for my channel, and this is the last segment of the conversation I had with her. And in this, we're going to talk about medically assisted treatment, one of the most controversial issues in the field of recovery. So a little perspective, I take a blood pressure medication for high blood pressure. That, in fact, is medically assisted treatment. So is the insulin you take if you have diabetes, or the SSRI you take if you battle depression. Now, for some reason, there's a perception that when it comes to addiction, people should not have the same options as people with other illnesses have, and that's just plain wrong. And I can tell you from my struggles and my battle with addiction, there were days in that struggle where I just didn't have the fight in me. And for me, I had to, at times, drink to get to the next day, or go on a certain type of medication to prevent withdrawal so that I could get to the next day in hopes that I could fight the battle again. And those moments were life-saving to me. Now, if you're on heroin, other opioids, that may be Suboxone, it may be methadone that you need to take to get you to the next day. It might also be a clean needle so that you're not contracting HIV or spreading Hep C, for example. These are all ways that we help people. So the controversy, where does that come from? I've heard repeatedly in the world of recovery from heroin addicts that the best way to get off of subs or Suboxone is to go back on heroin. And we heard from a woman I interviewed not too long ago that she employed a methadone clinic to get well. She utilized that for a year, and the results were unbelievably positive for her. But along that journey, she came across people who were potentially abusing that system. The abuse is there, it's not going to go away. If you think about opioids, how many millions, if not billions of people have benefited from the effects of opioids, while it's also destroying other people that are susceptible to its effects? Doesn't negate the benefit of the drug. So here, Dr. Mo, and I hope this creates some different thoughts in your mind about different ways people may need to employ recovery work. Thanks for being here, and I hope to hear from you. Mahalo. I have this idea that if you look at the success rate of recovery, how many people truly stay abstinent once they get on this journey, everybody that doesn't, I think to a degree, is marginalized. Mm-hmm. And I think integrating MAT into recovery is a really eye-opening idea. Yeah. Because I think it enables people to succeed in life that otherwise feel like they're not capable or not worthy. Absolutely. So you have a tremendous amount of experience with that topic, and dive in. All right. Tell me what you think.
I could talk about MAT for days. So at first, when I'm going to start honestly where I started. I remember hearing about a program in Alaska, I believe it was Alaska, that was handing out clean needles that were fully loaded. And I was like, ooh, I don't know, maybe I'm not ready for that type of like harm reduction work, if you will. But then I realized, like, no, if you're not in a space where you can get healthy and a clean needle so you don't get HIV or hepatitis, and the drug that's pure, that's not going to kill you, if that's what you need in this time and space, then do it, right? And so I've been doing drug policy for a long time. I just got back from Amsterdam before I came here to the island, and looking at their drug policies and better understanding them, and China white heroin, handed out right there by the government, and now it's not shocking to me, but at first it was. And now I'm just like in awe of these programs, because what they truly care about is keeping people alive, right? And that's what we want. So we think about things like patches, nicotine patches for nicotine, removing nicotine from your life, and that isn't a thing. But when we look at, replacements for opioids or replacements for alcohol, for some reason there's a stigma on there. And societally, we've done that to people, and the only thing that we're doing is killing them, right? I just was talking about label avoidance and what label avoidance looks like, and if I think I am someone that I'm going to get labeled for something, I'm not even going to try and get help, right? And if I know that my addiction or what I'm struggling with is so severe that the only thing that could help me is some sort of medication, but it's not appropriate, like I'm going to avoid the whole situation. And I think oftentimes when we're talking about fentanyl, fentanyl is extremely difficult to detox from. It's extremely difficult to get away from. I have friends that still use drugs, and I think that's what keeps me relevant. But they talk about, like I've tried Suboxone, I've tried Vivitrol, I've tried all these things and they're just not meeting the mark. And we don't normally go for methadone for fentanyl, but that's kind of what we're getting back to. Let's go back to methadone. Let's go back to that gold standard for other things. And so as much as we may feel like we have these ideals about what it looks like, or like you're not sober if you use medical assisted treatment, any other disease, we would use medication to intervene and get people healthy. Now, do people stay on medication forever? Some of them, that might be what they need, right? But not everyone does. Some people just need it to get through the withdrawals. And if you've ever had COVID, you know how terrible it feels to have the shakes and a fever and pain and everything just feels horrible. That's exactly what a withdrawal feels like. I think that was the first time it could ever go, oh yeah, I've felt withdrawal before, and oh my God, I felt COVID, and now I can have something I can tell people like, have you had that? That's what it feels like every time you come down, right? And so being able to give them an Ativan or something to get through that, or if you're detoxing from alcohol, like people die from that.
Yeah.
I just had a friend not too long ago said, my dad tried to quit drinking and he died. And if he would have known that it was okay to go get medication, that he shouldn't and couldn't do that on his own, then he could have had medication to live through that and be out on the other side, So it's extremely important that we use these medicines that are evidence-based to be best practices for addiction and what it looks like.
There's an analogy I love to use. Again, I'm going to give you two dates, 1961 and 1986. Okay?
Okay.
If you had a heart attack before 1961, you were maybe given some blood thinners and a pat on the back and a lot of bed stay and hope you get well. Right? The first cardiac bypass surgery was done in 1961. Now, find me a person who doesn't know somebody that's had that procedure.
Right, yeah, absolutely.
Would you agree that that's a beneficial effect to have, right?
Absolutely.
1986 is the first time a stent was used in a human. Would you argue the validity of using that to help cardiac patients? Of course not. So I think that the analogy I'm trying to make is, progression happens.
Absolutely.
And you can't judge something just because it wasn't there before.
Exactly.
And I think with MAT, you raised a good point. Like some people have to take antidepressants the rest of their life. Mm-hmm. Are they not sober?
Right.
Are they less than?
Yeah, absolutely not.
We put those labels on people coming out of addiction and needing assistance like that.
Right. And in a space where we should be banding together to go, hey, we understand what addiction looks like and we've all been through it. We just chop each other down. Oh, you're not actually sober because you're A, B, and C, or you're not my kind of sober, so you're not really sober, or you didn't do this or that, so you're not good enough, why we're all in this together. And there's only a handful of people that really understand what addiction looks like.
Yeah.
And those are the people I'm drawn to, honestly. But because we can have that conversation, and I can say like, hey, my dopamine system is broken just like yours. Mm-hmm. And we can talk about what that looks like. So to cut other people down or make them feel less than because their path didn't look like you, honestly, it's killing them. And if they're struggling with opioids or fentanyl or some sort of extremely powerful drug, and they know that there's medication that they can go back to if they go back to use and can keep them alive, so important. Or medications to help them wean down from alcohol. I love Vivitrol for that reason, right? It's a shot, it comes once a month. You don't have to make that choice every day. If you're not feeling tough enough to make the choice not to drink every day, there's something that'll help you, right? If you're not feeling tough enough to crave your food cravings, there's medication for that too, right? There's medications for all sorts of things. And man, when we put stigma on them, we hurt people.
Yeah. Yeah, stigma is a really powerful force in virtually every way. Going back, I want to get to that topic in a minute, but on MAT, can you in your personal experience, can you say, yes, this has helped people I know for real?
Oh my God.
And do you think that there's a better future, a brighter future for MAT?
100%. We know, yes, I've seen it help people. I know people who have got into recovery, stayed alive because of it. I know people that are using it right now. I know people that get a shot every month. I know lots of people who are finding solace in that. Does it work for everyone? Absolutely not. It truly doesn't. And I'm not going to say it does, but I can't think of any other medication that does. And are we going to see a better future in this? Yeah, we 100% are. There are people that are out there like us doing the work to talk about what it looks like to break that stigma. We got doctors that are starting to understand how we can utilize this medication in order to help people. And we're difficult for the medical profession. We really are. We come in with like, this isn't really what's wrong with us, but this is what's wrong with us. Like, sometimes we're messy. There's lots of things that come into play, but people are starting to understand this is best practices.
Awesome. This is Patrick. Thank you for watching, and I hope that gave you some new insights into how we go about recovery, the tools available to us. So before I close, I wanted to do a little thought experiment with you to kind of drive the point home. What I want you to think about is make a plan so that you don't eat for an entire week. Sounds kind of silly, but I want you to report back and tell me how it went. Like, think about what is it that powered you through every craving you had 100 times a day, that unbelievably strong urge to just say, fuck it, I'm going to go out and eat, even though I said I don't want to. And tell me how it goes. Where did the strength come from? You know, what were the challenges to that? How did you overcome it? This may seem far-fetched, but it's a really good example in the fact that, excuse me, addiction lives in the very same part of your brain as your primal drives for food, water, sex, right? Preservation of you as an individual and the species. These are drives built into us for that purpose, right? To existence, preservation. That's the power of what we're dealing with when we combat addiction. So the idea that you can just remove a drug from somebody's system and think that with some social support they're going to bounce back to normal just doesn't work. It's unreasonable. It's harmful to think that that's a viable option for a lot of people. Some people it does work for, but many people need some help. And if that help is in the form of a medication, so be it. I hope that helps, and I hope that puts some perspective on what we're up against with this battle. Thanks for being here, and I hope you come back. Thank you.